What happens when you gather a healthcare tech business leader, a health expert and certified life coach, and a social media savvy entrepreneur to ask them questions about the most pressing topics of today? Let us find out together on The Futurist, the health advocacy episode. Greetings, I am Flash, your Futurist host. Allow me to introduce our contestants. President of the Pelvic Health Operating Unit at Medtronic, health access champion and published author, Emily Elswick.
Hello, Flash.
Speaker and certified life coach, Dr. Stanta Quilette DeVell, also known as Dr. Q.
Hey, Flash.
Entrepreneur, philanthropist, and the first Black woman to own a sports team in the metaverse, Sara Hood.
Hi, Flash.
Our contestants will be playing a simple tower stacking game. Each contestant will select a block. Some blocks will trigger a health advocacy related question, and others will start a minigame. If you win a minigame, you will receive a power-up advantage. The first contestant to knock the tower over loses.
I tend to have a quiet demeanor, so people tend to underestimate me. But I love being the underdog because I always win.
I am a star. I'm used to all the lights. This is where I need to be every day.
You have pulled a question block. Healthcare professionals and patients alike can sometimes have the mentality that the doctor is always right. What are your thoughts on this mindset?
I really hope that we encourage patients to make sure they're asking really thoughtful questions to their physicians. Are there other options for them? Are there second opinions that they could get? And make sure that we're finding those choices. At Medtronic, it is about the patient and improving their lives. And Medtronic, it's all about alleviating pain, restoring health, and extending life. And that's a motivator and a competitive driver for me every day.
Good job.
Dr. Q, you have pulled a question block. What are some basic things people can do to better understand and advocate for their health?
I think it's really important to trust your intuition. Look among your peers and ask. You can compare and contrast and take that back to the doctor so the doctor has something. But push all you can, push. Don't just stop at no.
Esteem of thyself. There you go. Great job.
Sara, you have pulled a question block. As an influencer, your content focuses on empowering women and celebrating motherhood. What health advocacy tips do you have for mothers and expecting mothers?
No one knows your children better than you do. Advocate like your life and their life depends on it. Research is important, but being able to communicate what that means is so critical. The idea of wasting my ability to communicate to the world what I have to say, the idea of wasting the ability to communicate even about my heart attack, all of that encompasses what Sara Lifestyle is. It's not the love of style, it's the lifestyle in which I choose to live, which is through and in love. Well done.
Stigma can play a role in a patient's ability and desire to advocate for themselves. For example, 44% of people say they are embarrassed to talk about bladder control problems, and more than 50% of people with incontinence haven't even discussed it with a doctor. Working in pelvic health, you have experience with stigmatized health conditions. Can you further explain how stigma impacts a patient's ability to advocate for themselves?
Stigma plays a really big role in whether or not you're going to seek care, and also whether or not you're vulnerable enough to be able to have that conversation with your physician. 1 in 6 of us have overactive bladder or suffer from urinary incontinence. 1 in 12 of us suffer from fecal incontinence. But it's definitely an opportunity for us to talk about this because there are so many therapies available for patients now to really manage the signs and symptoms of overactive bladder.
And my bladder is still not the same since having the kids, so.
Beware laugh, beware sneeze.
Yes.
Yeah, exactly.
The game is started.
This is a game.
Has started.
The game is on. That was a good one.
Dr. Q, how do you use technology like social platforms, search engines, and other online resources to help advocate for your health?
Technology is shifting the paradigm. It's revolutionizing what patients had previously than now.
And if I could add, with social media, you can find people who are not only dealing with what you've dealt with, but how they overcame it.
You don't feel alone.
You're
you
not
don't
alone.
feel alone.
Ooh. Nice. Well played.
It's not uncommon for patients to feel they haven't been heard by their doctor. as a women's health philanthropist, do you have any experience with or thoughts about the importance of medical equity?
I had a heart attack 6 days after I had my son, and the only reason why I'm here today is because my mother advocated on behalf of her child. Had she not advocated and said that something was wrong and fought tooth and nail to say she's not okay, she understood my symptoms, and then was able to communicate that to the doctors and nurses who thought that I was perfectly fine and that it was just due to having a brand new baby. I'm so glad that she did not listen, because I'm here to talk about it today.
Let's process that more. Emily, what are some of the factors that lead to patients, especially female patients, not feeling heard, being misdiagnosed, or not receiving proper treatment?
Women, absolutely, their voice needs to be heard. I would argue our voices need to be respected. Yeah. So if we're coming to you as a physician with questions, with concerns, it's absolutely, I think, our right to say, what more can you do for me? Or who else can I talk to? Where is there a specialist that I can go to?
And you should listen. That's why I think it's so important when you go to the doctor, already have your list of questions that you want to ask your doctor.
Lord knows I'll forget by the time I get there, so write it down.
Nice. Oh, nice one.
Ooh, come on now.
Sara, you have activated a minigame. Please proceed to the minigame arena. Welcome!
Thank you, Flash.
I will share a series of 5 statements, and you must determine whether they are fact or myth. You must get 3 of the 5 correct to receive your advantage.
Okay.
Heart disease, cancer, and diabetes alone cost 74% of all deaths globally, and more than 3/4 of those cases occur in low and middle-income countries.
Can I phone a friend?
Unfortunately, the game is not optimized for that option.
True?
Correct. Next question. A study found that women who went to the emergency room with severe stomach pain had to wait almost 20% longer than men with the same symptoms.
That is probably true.
Myth.
Really?
The study found that women actually waited almost 33% longer than men with the same symptoms.
I wouldn't believe it.
Next question. Nearly 1 in 10 Hispanic children in the US lack a usual source of care when sick.
True.
Correct.
It's hard because I want to be like, yay, but those are all incredibly sad truths.
While these facts may be hard to face, I hope you can find some joy in knowing that you have won the minigame. You have received a power-up advantage. You may skip a turn of your choosing. You can use this advantage on any of your upcoming turns.
Thank you, Flash.
Please, rejoin your fellow contestants.
Good job, Sara.
Wow, well done.
You did that.
Thank you.
I don't know that I love that you got the power up. I don't know what that means yet, but
Yeah.
good job.
Thank you. Even though it feels great to win, it's also sad that these statistics are true. Now that I have the power up, my competitors should definitely watch out.
Dr. Q, how has your experience as a survivor of heart-related health challenges shaped your understanding of the importance of self-advocacy?
Being a patient, it has tremendously shaped my advocacy, and primarily self-advocacy. Just really being aware and holding myself responsible. The more you share, the better for you. And that's what I've learned. The more that I share with my doctor, the more I question my doctor, the better the health outcomes are. So I think it is so important to share our stories and to talk more when it comes to our health. Good job.
According to a report from the World Health Organization and World Bank, more than half of the world's population is not covered by essential health services. You have experience working with rural communities. What health disparities have you seen in these areas, and what can be done about it?
When you think about overactive bladder in places like India, they're worried about water consumption. They don't buy diapers, they don't buy pads, they deal with cloths, right? They're not able to wash those cloths. So when you think about women facing overactive bladder, their increase for UTIs and just overall infection is so much higher. How do we deploy technology in a way into these developing markets that they can actually access, but they can also live with for a lifelong implant and opportunity? We're really encouraged and excited about what we're able to do to bring some of these technologies to people that are in developing markets. Healthcare advocacy is really along the entire patient continuum. And then how do we make sure there's access to all the advanced therapies and treatments for every patient, regardless of gender, regardless of socioeconomic status, regardless of ethnicity, that we make sure that every patient has access to the best healthcare.
Sara, you have created a community through social media. How does this community help support your health and ability to advocate for yourself?
The opportunity of social media and to create a community is a privilege that is not lost upon me. So by building a community, I have learned not only to be silly and create laughter and teach business and lifestyle that's relatable, but it's also advocacy. It's being able to have conversations in my DMs and in my comments with women who have questions about their health, who have questions about my health even, who are wondering what signs they should be looking out for, what does a heart attack look like, but also encouraging them to advocate for themselves.
Emily, how have advancements in miniaturization and smartphone technology impacted how patients can manage their health today?
Healthcare technology has come a long way. We were using cardiovascular devices that were as large as a computer, and now we're miniaturized down to really the size of a coin. But we're really excited about wearables, right? But also the ability to engage with patients through applications that allow us to stay with patients along their journey with therapies. MedTech is really on the precipice of doing really great things to have as minimally invasive a possible experience with technology as humanly possible, but giving them amazing outcomes too.
And as controversial as it sounds, AI in medicine right now is booming, making things so much easier.
Absolutely.
They workouts right now.
We are.
Listen.
All right, Flash, let's do it.
Sara, how do you advocate for your son and his health?
Advocating for my son is one of my greatest honors and privileges. Because he is nonverbal, he can't tell me what's wrong. He can't tell me what he needs in the general sense. So I know based on sounds, his movements, what it is that he needs. And what I will say is that I'm going to be the loudest person in the room. The part of me that I didn't know existed happened and occurred because of him. I found my voice because of him. I became a wolf of an advocate, and I hold no mercy for anyone in terms of advocating for him because he can't advocate for himself. If you are a mother, if you are a father, please advocate for your children.
You got it. You got it.
Sara, you have pulled a question block. How does technology play a role in your health and also advocating for your health?
Yeah, so there's two things that I would say. First part is because I had a heart attack, I typically will have a monitor, some sort of a wearable on for my workouts. That way I can track my heart rate, also track how many calories I'm burning, and make sure that I'm staying healthy during all of my workouts. The second thing that I will say was after my son was diagnosed, I couldn't really find information about the kind of therapies that he should get into. I'd never heard of ABA therapy until I heard it on one of the social media platforms. And because of that platform, I went and did some research and learned, and now my son is in 30 hours a week of ABA therapy, which is applied behavior analysis, which has entirely changed and shaped the life that my son is going to have. Oh, absolutely not. Flash, I'm using my power up right now. Right now.
I object.
With Sara's power up, she is able to skip her turn. It is now your turn to pull a block, Dr. Q.
I was kind of like trying to align my energy with the tower and visualize it. Don't let it fall. But sometimes we overthink things.
When that tower fell, I was like, whoa, at least it ain't me.
I knew I was in for some significant competition, but it was super enjoyable just being with them and competing with them, but also talking to them about their life and their experiences and what they're doing to advance healthcare.
The game is now concluded. We have learned much about health advocacy. Thank you for joining us for this episode of The Futurist, brought to you by Medtronic. Goodbye.